Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Michelle Allen. She's Vice President and General Manager of Healthcare Technology at Rauland, and Joseph Delisle, Director of Project Management at Rauland. Welcome.
Thanks, John.
Thanks for having us,
Thanks
John.
for having us.
Yeah, excited for this discussion. It's going to be a lot of fun. Michelle, why don't you start off before we dive into our topic? Tell us a little bit about yourself and Rauland.
Sure. So, John, I'm Michelle Allen. I've been working in healthcare technology for over 25 years. I started my career as a biomedical engineer in medical device R&D. And for the last decade, I have been working leading businesses that develop clinical quality, safety, workflow, and analytics solutions for health systems. I joined Rauland a little over 2 years ago. I was excited to help them with their evolving strategy to expand their software and analytics platform.
Awesome.
Rauland is a global leader in clinical communications. We take nurse call hardware and integrate it with software that streamlines care team workflows and provides analytics on patient behavior and staffing response times. Rauland's installed in over 1 million acute care beds globally. And, we work on creating an open and interoperable system for our customers so that we can really drive clinical communications and nursing efficiencies for our health systems.
Awesome. And Joe, how about yourself?
Sure, John. So I've been a product manager in the healthcare space for about 10 years, initially on software and IT solutions. And for the last 6 or 7 years, I've been helping to deliver medical devices that incorporate both hardware and software components. So I've been at Rauland for just a little bit under a year, and my focus in that year has been on driving nursing efficiencies and satisfaction and expanding our interoperability.
Interesting. I think we underestimate the power of hardware and software. I love that you guys have some experience in both of those. But Michelle, talk to us, with the current nursing shortages in health systems, talk to us about that and kind of the impact that it's having on patient care.
Sure. I mean, this is a really important problem right now that health systems are facing. Nurses join or become nurses because they like to take care of patients. Mm-hmm. And with the staffing shortages, with increased documentation requirements, and with unconnected and out-of-date IT, they spend their time getting pulled in so many different directions. They're actually doing less and less patient care than they ever did before. Nursing turnover is at about 25%, which is actually a little bit better than it has been, but it's still way too high. Mm-hmm. And nurses are leaving the profession because of job satisfaction, burnout, safety concerns. These are just a few drivers that have them leaving well before retirement age. And this is a real concern for health systems because it's very expensive. When you look at recruitment, retraining, temporary employment, a hospital is spending anywhere between $40,000 and $60,000 every time they lose a nurse. And it's no wonder in a recent survey, the hospital CEO said their top 2 concerns were workforce retention and financial challenges. Yep. The problem's even worse because when you look at the nursing programs out there, there's not enough students to enrolled to address the gap that's being created. The U.S. Bureau of Labor Statistics recently predicted that we were going to have a shortage of up to 275,000 nurses by the year 2030. And nursing shortages definitely impact patient care. When you think about the fact that they're having much bigger workloads than they used to have, that means more patients to take care of. Yep. They're getting pulled in all these directions. And patients are sicker. There's higher acuity patients now, and so they're constantly being pulled do they spend more time with their sicker patients when they're being spread across way more patients than they would prefer to be spread across. And so, this is a long-term problem, and we really have to work on how do we both help those hospitals with nursing retention, but also how do we help nurses provide quality care with less resources.
Yeah, that's really interesting. I've seen it anecdotally from my cousin who texts me, on Facebook every night or so, from the hospital at midnight. She's working the graveyard, telling me about all the challenges and there's not enough nurses and stuff. It's fascinating, right? Because it's such an important thing that we need to solve. Joey, I thought it was interesting in your session here at HIMSS, you mentioned that these connected communications between the right people can help to improve nursing satisfaction. Talk to us about how Rauland helps to contribute to this improved communication.
Yeah, sure. So, at Rauland, we are improving communication through interoperability. And we're doing that and driving nursing satisfaction at the same time. And we do that in a number of different ways. So one of the key ways that we can increase satisfaction through interoperability is allowing nurses, or really enabling nurses, to practice at the top of their license. So with our intelligent call routing, we're able to route the calls and alerts from the patient room to the right caregiver for the patient's problem. So for example, think like a patient needs water or a blanket. The nurse doesn't need to bring that in. Right, so we can route that call to a patient care technician or someone else on staff who's more appropriate to bring that in. So that's going to free the nurse up to provide clinical care to their patients. Right, and our intelligent call routing can drive satisfaction in another way as well. So because the right folks are getting those alerts at the right times, there's less noise in the unit. Right, so they're getting called on their phones, that we're not enunciating it out loud. So the units themselves are a lot quieter, and we're able to reduce some friction in that way.
That's really interesting. And it's interesting, you kind of talk about this communication change that's happened, right? Mm-hmm. And this improved communication, how that impacts nurses. Mm-hmm. But you also mentioned interoperability. Yeah. Talk to us more about the role of interoperability with different systems and how that can enhance it, and kind of, what's Rauland's approach? Is it an open system approach to doing this, to be able to help this? Talk to us about that.
Yeah, sure. Michelle, you want to take this
Michelle,
one?
Sure, yeah, so let's start with that first part. You're absolutely correct. So our system is designed to be open.
Okay.
What that means is we have standard communication protocols like HL7. We publish all of our APIs and make sure that every vendor knows how to connect to our nurse call system. In addition, we offer a vendor validation program.
Okay.
So any vendor who wants to connect to Rauland, we can do that and certify that with them in our offices, in our labs. And so we're working out any kinks before we're in a patient care environment. And that's extremely important, so the clinicians don't have to worry, it just works out of the box. This is important because hospitals are introducing new technology all the time to drive that efficiency that you talk about. And that technology comes on disparate platforms. Those platforms, if they're not connected, actually increase the burden on the nurses because they're having to chase data in all these different systems instead of going to one place for the source of truth.
Alerts from all these places.
And so to get that total picture of the patient, they're having to go all over the place. And so in an effort to get to efficiency, the other thing that's really important for health systems is they implement standardized workflows. And a lack of interoperability really slows the progress of standardized workflows because they have to do different things in different places based off the systems they have.
Yeah.
So I'll give you an example, and you'll see it
great.
out here on the show a lot. Everyone's talking about virtual nursing. And hospitals are implementing virtual nursing systems right now. Now, the great thing about this technology is it was designed to reduce the workload for the nurse at the bedside. It's meant to be a tool that helps them. Yeah. But if that technology comes in and it's not interconnected and not part of the workflow, we've actually just increased the burden for the nurse because now they have to learn a new tool and they have to make it work for the patient. And that's one more thing they're doing instead of taking care of patients.
Yeah, sure. That's interesting, Joe.
And our interoperability takes all the data from these disparate systems, and we're able to provide actionable insights to what's going on in a unit. So we have insights into staffing levels, patient needs, and we're able to enable nursing leadership to augment the staffing on the floor for a nurse who has like a high need patient. So all that interoperability comes into play through different systems, and then reporting and bringing the insights back into nursing leadership so the patients can get the care from the folks that can give it.
That's awesome. Any other examples, Joe, that you could offer where you see Rauland's solution kind of addressing these challenges of interoperability?
Yeah, so I recently went to Australia to visit a couple of hospitals down there, and one of them had a situation where their patient satisfaction, their nursing satisfaction was really trending low. And they dug into the cause, and it was largely due to the noise in the units, right? So the alarms are blaring constantly, and it's unit-wide. Patients couldn't get any rest, and nurses were scrambling to cover for each other, find the right caregiver, and overall it was a relatively bad experience. So
yeah, patients are angry because the alarms are going off, they're not sleeping, which takes out on the nurse, and it all...
Exactly, and there's multiple different devices in the room. They can all be alarming for different reasons. So this particular hospital worked with our local distributor on a concept called a quiet unit. Okay. And what that entailed was with our Responder Enterprise platform in the middle, integrating to these disparate systems in the patient room to take those alarms and through our system, route them to the right caregiver at the right time. So think in the room, you've got your IV, you've got your bed, you've got your patient monitoring, even an RTLS system that can track patients and even nurses. All of those can trigger off different alarms. And at this hospital, they were triggering off alarms quite frequently. So through our platform and our integration with the hospital's mobility vendor, we were able to send quiet alerts to nurses, to care techs at the right time so that they could address those issues. And only when the care was late would we enunciate that across the entire unit, or if it was a critical issue. So that helped out immensely in the units where they implemented this. The patients were happier, and in surveys done before and after the implementation, the nursing satisfaction went up as well. So it was a great outcome.
Well, it sounds like one of the biggest values there is this centralization of all the alerts and data, so that you can understand how much they're getting alert. Talk to us about that. Is that the key, is interoperability, to be able to have all the data centralized?
Yeah, I mean, without interoperability, the data lives in silos, right? So you've got these different systems, and if a nurse manager wants to see how their unit's performing, how quickly they're responding to calls, they need to go into each of these different systems, and they'll look at it as a point in time with no additional context. So when systems are interoperable and integrated, like into our system, we're able to provide additional context around the entire patient stay. So we can give insights into a specific unit, a broader hospital, or even a hospital system. So they can drill in and see how responsive their nurses are to different calls, different alarms, and different alerts.
Interesting. So Michelle, we kind of started off this discussion talking about nurse staffing, the issues there. How can this technology be applied to staffing and kind of better align the nurse's skill set? Because not all nurses are trained in certain things, right? With the needed levels of care. How can we use this technology to help those?
Sure. Well, that first step is interoperability, as Joe was just talking about. By having a single source of truth, we're able to give data to nursing leadership to form actionable insights for them. So in our system today, we have patient behavior, we have risk profile of the patient. Are they likely to fall if they get out of bed? Is there a concern for their safety in the room? We also have the patterns of the nurse call, the alarm frequency, and the response time of the clinicians. And they can take all of this together and make real-time staffing changes based off of that information. So they can determine what skill set is needed for which patient populations, so the right level of care is provided with the right skill set. And then they can also deploy patient care technicians and other resources to be additional support where maybe the nursing skill isn't required, but you have a needy patient who needs water or a blanket or is just lonely and wants someone to talk to a lot. Where we hope to take this technology in the future is by taking that data and applying AI so that we can predict the patient behavior. We have all this data now today that we can eventually train models that will predict the patient behavior and then proactively reach out instead of them having to look at the data and tell them how their staffing model needs to change to associate the right level of skill set with the need of the patient.
Yeah, that's really great. It sounds like a pretty novel application of AI too, since you have a really interesting data set there. I was impressed by the vastness of what you guys are doing. You gave the Australia example, worldwide, and you have a long history of that innovation in these call systems. How are you going to continue leveraging this broad distribution that you have, with resellers, I imagine, around the world, to continue addressing these healthcare challenges?
Sure. Well, Rauland's been a leader in nurse call for over 40 years with 4,000 customers to learn from.
Wow.
We take a lot of pride in being innovative and really bringing new solutions to the market that help health systems with their key problems. A lot of what we're talking about today wasn't a problem 10 years ago. It's a problem now that we're trying to solve. We have over 235 patents, and we were just recognized by Crane Chicago for being a top 25 innovative company in Chicago. So we work really hard to continue to learn from our customers and make sure we're solving, their most pressing problems in communication and patient care. Our distributors help us with that because they're all local. We have a broad network of over 100 distributors spread out across 30 countries. And so they really know the practices and needs of individual health systems. And we bring our large technical, their large technical, our large clinical, their large clinical teams all together so that we can work with health systems and standardize workflows, customize analytics to help them achieve their specific goals or outcomes that they're focused on in a given time.
Interesting. So you get the enterprise with the local. I like that.
Yes, and we're all, the other thing, as Joe was mentioning in Australia, our distributors are really help us with this interoperability goal. We want to encourage openness, we want to encourage interoperability with everything, because the more we stay connected to all of these other technologies, the more nurses can focus on patient care.
Yeah. Well, you said something really interesting. We didn't have these problems before. And I'd also argue we didn't have this data before.
Exactly.
And so there is a real opportunity to leverage this data and to address some of the challenges that nurses and healthcare organizations are faced. So Joe, Michelle, I really appreciate you taking time to talk with us and share these insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks.
Awesome.
Thanks, John.
Thank you.